I'm joined by Minister Quayle today. We're going to be talking about this document that is going to be playing a part in everyone's lives, I think, health and social care in the Isle of Man the next 5 years. I mean, it's just, we're probably going to do quite a lot of sections on this because it's a step-by-step to go through this. But I mean, even in your forward, I mean, you say that the health service people want to deliver a better, more efficient service, integrating health and social care. Integrating comes through all this.
Yeah.
And their intentions are good, but their progress is patchy. And there's still a long way from achieving a seamless service where people are treated in the right place, at the right time, as close as home as possible. I mean, that's an interesting forward alone from you.
Yeah.
I mean, quite damning in a way, isn't it?
No, it's not damning. I want to have an honest conversation with the people of the Isle of Man, so that there's no point beating around the bush, trying to make out that everything's rosy in the garden, because it clearly isn't. But that's not just the Isle of Man, that's most of the developed world. The cost of providing a health and social care policy to the people of the Isle of Man, and as I say, the developed world, the models are totally unaffordable for the next generation. So, we need to improve our efficiencies, improve the service that we give the people, but we've also got to get better bang for our buck and get better value for the money that we spend, because the amount we spend for health and social care is a third of our entire net budget.
I mean, over 234, was it, million, it says in here that you've got to look after. In fact, it's more, isn't it?
Well, to put it into context, Paul, we as a department net spend £184 million. Now, if you look at the total residents' income tax payments for the year, it comes to £178 million. So we are spending more net in a department than the entire residents' income tax.
Well, you said at the end of your intro, if you can't do it here with 85,000, you can't do it anywhere, sort of thing. I mean, this is a model that you should have some control over.
Yeah, it should be easier, with only one healthcare trust, you could argue, to do it. It should be easier to do it here than elsewhere. And this is a worldwide problem. A small number of countries are already tackling it. Quite a few are putting their head in the sands, and an awful lot are saying, right, well, we've got to do something. We're hopefully just ahead of the curve in making these changes.
It all goes back to 2011. You had a review, well, before your time, presumably, on this thing, but you picked up what was said there. It was a review lasting 10 years. A strategy was put in place.
Yeah.
Things have changed, but so far, do you think you're going in the right direction?
Well, we're going in the right direction, but probably not at the right pace. To date, since I've taken over, we've updated our IT systems, Medway, so that we can now start to do benchmarking, store data. Hopefully in the future, in the not too distant future, we'll be able to have electronic paperless records for patients. So getting the foundations correct is really important.
And you want a health service, not an illness service?
Yeah.
To make people look after themselves better?
Well, one of the key points is for people to take responsibility for their health, whether it be diet, exercise, smoking, drinking. We've got to, as a society, improve on that, because if we don't, type 2 diabetes, heart attacks, cancer, the way we look after our own life can significantly reduce the chances of us getting some of the severe diseases that are out there.
Okay, I mean, the last census, 2011, and expected to grow approximately 16% over the 20-year period, and the cost of healthcare over the age of 80 will almost double. I mean, this is all just mind-blowing numbers, which obviously the actuaries have, worked in. This is where it's going to go, but in a funny, or not funny, but in a perverse way that you're asking people to be healthier, they'll live longer, which puts more burden on
yes,
you.
No, if you live longer, but in a healthy way, I mean, at the end of the day, sadly, we all must die, but if you can live for the vast majority of your life in the community, where that's a relatively cheap way to live. It's good for you. B, from a pound, shilling and pence from the taxpayer point of view, it's the most economical way of living. I think in the charts that I've been presenting to people, I have 4 areas of low cost right up to the high cost of acute hospital, mental health facility and nursing home. So we can enable people through prevention is better than cure. Perseus said that, I think, about 47 AD.
But we're all going to fall off at some point.
We are going to fall
fact,
off at some time, yes.
In England, life expectancy is about 79.2 for men, 83 years for women. But of course, this is a bit life expectancy with good health.
Yeah.
Instead of being like you're living to basically 80 for men, by 63 and a half, on average, the decline is in, and the health service is then required. Women living to 83, but by 64 again, their health on average is starting to fail.
Yeah, and that's why I think by the model that we're proposing, Paul, is to be more preventative. So I'm not going to stop our health service can't stop everyone from having a stroke, from having a heart attack, but if we can reduce that percentage of people by doing more screening, by educating people in looking after themselves better, then we can reduce the amount of people having to go into hospital and improve their quality of life, as you've picked up, Paul, from that age 63, 65 to when they do shuttle off this mortal coil, to quote from Macbeth, I think it is. Then we want to give a quality of life to people in the golden years of their life, not to be having to suffer, having had a stroke, say at mid-60s, spend the next 15 years.
Yeah, I think my point was being that if you make people enjoy themselves and live longer and be very healthy, at the end of the day, they just live longer, and they're still going to have that point in life where they will require all these services.
Palliative care and various services. You're absolutely correct, Paul. And that's why we must tackle this problem. We can't put our head in the sand. In the last 3 years, the additional number of people claiming a pension has increased by 2,400, but the number of people paying tax has decreased by 1,100. We're living longer and we're having less children, so we've got this ageing population, which you can say, because of the advances in health and social care, is fantastic news for the public, but it's got to be funded.
Okay, well, there's lots in this, and we're going to do quite a few sections.
Yeah,
I think
fine.
So people can take it all in. So
Yeah.
join us for the next part of this interview.